All right, this lecture is the one that is in Word instead of PowerPoint because this will allow me to draw and explain as I go. We're going to talk about vertebral curvatures. Now, the vertebral curvatures have to do with the line of gravity. We're thinking about how we stand up straight. The spine isn't actually straight. It's curved to balance around the line of gravity. We're more like a spring, which is more stable than a single point of line. Imagine trying to stand on a single tiptoe and how unbalanced that is. It's very straight. Versus if you spread your feet out and you kind of flex your knees, you're much more stable. So that's why we have this line of curvature. And we think about that, we're going to start with fetal development. And what we see is in fetal development in utero, all the regions start in what we note as a primary curvature, which can be written as 1 prime, as I've done there in the parentheses. And the primary curvature is anteriorly concave. Remember, concave is it caves in. And I've drawn this kind of happy baby with the C-shaped curve and the arms and feet coming forward, but they are anteriorly concave. You can also say posterior convex. What you cannot say is just concave or convex. You have to say from which direction, because laterally it's even. So you have to say for the direction. So I'm going to do anterior. If you choose posterior, just be consistent. So everything starts anteriorly concave in fetal development. Then in the 3rd trimester of development, this is still in utero, the cervical region begins to develop this secondary curvature, which is anteriorly convex. And this anteriorly convex, anteriorly convex means that the cervical spine curves the other direction. And this starts when the baby basically starts pushing their head back. The rest of the spinal column stays in the primary curvature. So only the cervical region is secondary. The secondary finishes at about 2 to 3 months after the baby's born, when they actually can hold up their head. This is why when a baby is first born, if you're holding, say, a newborn, you have to support the head as they aren't strong enough. But by the time they're 2 to 3 months old, they're able to hold their own heads up enough to hold it up. So that is the first secondary curvature. Then, at about 9 to 11 months old, the baby is now starting to crawl and to start to stand up. This is where the baby will use like a chair or a couch, mom or dad, to pull themselves up standing. This is how we start the other secondary curvature. It's still considered secondary. It's still anteriorly convex, but it's the second place we start a secondary curvature. And they start to stand. This finishes when the child's about 2 years old. I realize that they walk before then, but the curvature actually is fully developed by the time they're 2. And I'm noting here that the thoracic and the sacral regions stay in the primary, but cervical is secondary and lumbar is secondary. The final curvatures in an adult are cervical is secondary, thoracic stays primary, lumbar is secondary, and the sacrum stays primary. This gives us those forward and backward curves to give us that spring of development. But sometimes things can go wrong, and that's what we call pathology. Pathology is when the curves go wrong. The first one is called kyphosis, and I underline kyphosis. Kyphosis is an exaggerated primary curvature in the thoracic region. The main cause of kyphosis is osteoporosis, old age, the loss of bone, and literally the thoracic spine vertebrae are breaking, causing that curve forward. So we see this in old age. Some people refer to this as the widow's hump, or the old lady hump, where she moves forward. Remember that this is all anterior to posterior, so she's falling forward. Her body is bending forward as she does this. This is frequently why older women will use a cane as a balance point, because her body is so tipped forward, but it's in the primary curvature. So when the question says, what is it and how does it differ from normal? Differs from normal is that it's exaggerated in the thoracic. It is exaggerated primary in the thoracic region, and the cause is osteoporosis or old age. The other one, or another one, is lordosis. Lordosis is an exaggerated secondary curvature in the lumbar region. The only time this is normal is during the third trimester of pregnancy for the mother. Basically, what happens is in the third trimester, the baby's weight anteriorly, because of the belly, pulls her so far anteriorly, it pulls the bones out of alignment and causes them to bend. This is why frequently pregnant women are rubbing their back or have backaches, is because it is pulled out of alignment into this exaggerated lordosis. After the baby is born, moms find that they have to actually work really hard to pull their lumbar region back. They might actually do core exercises, whether it's yoga or Pilates or some other kind of core exercise, to strengthen their back muscles and their abdominal muscles to pull their lumbar region back into proper alignment. And if they don't, they're in for a lifelong time of back problems. The third abnormal curvature is scoliosis, and this is a lateral curvature, where before we've been looking kind of at the lateral view. I want you to think of this as the anterior view of this person. And we get this lateral curvature in either the thoracic or the lumbar or both region. This is the only one that the cause is completely unknown. And this is the only one that happens to children. Usually we see it in 11 to 18-year age range where it starts to develop. Anything up to a 10-degree tilt or lateral curvature, they will ignore. But this is where in elementary school, well, usually middle school and high school, your school nurse or your PE coach might have had you bend over and touch your toes, and they were checking your spinal alignment. They started that about 40 years ago, and they're trying to catch the number of scoliosis cases because it is treatable. Only a very few need surgery. Mostly they do it with bracing and exercise. So the three abnormal curvatures are kyphosis, which is thoracic and caused by osteoporosis, lordosis, which is in the lumbar region only, caused by pregnancy, and scoliosis, which has no known cause and actually happens during the teen years. So those are the curvatures of the spine.